This is a step-by-step crash course to the approach of stroke management. This video is approximately 2 minutes, and once you've watched it, the patient has already lost 30 billion synapses. Once you've received your stroke patient, you can click on the Start New Patient button to start the stroke protocol. Complete the patient details on the stroke app. The glucose, blood pressure, estimated weight, as well as possible time of stroke onset should be entered. There is no need to perform an arterial blood gas or an ECG. Remember, time is brain. A green gel code should be inserted into the patient if the stroke onset was less than 4.5 hours, but a grey or 16-gauge gel code should be inserted if the stroke onset occurred more than 4.5 hours, if it's an unknown stroke or a wake-up stroke. MTS is the time in minutes since the onset of the stroke occurred. If it's an unknown stroke or a wake-up stroke, place in the value of 270. Delay is the delay that occurred before entering the patient data, taking the vitals, as well as the delay that occurred by watching this video, which is approximately 2 minutes. The next slide contains the NIHSS stroke scale. Complete the stroke scale. But remember, do not lose time. Remember, time is brain. If you don't know it, skip this section. Once you click on the Proceed button, the stroke team will be notified. The patient's details will be sent to radiology. At this stage, the patient's drip has to be up. The patient's blood pressure and glucose should be within normal range. Remember to bring the stroke trolley on your way to the CT scanner and press the button that states press when transferred once the patient arrives at the CT scanner. Remember to follow the green line and don't forget your stroke trolley. For strokes of more than 4.5 hours, unknown stroke of onset, or wake-up strokes, please continue to follow the green line as stipulated on the ground. Once the CT scan has been done, press the Image Done button located at the bottom of the app. On the next slide, you will review the CT scan. If the stroke is ineligible for thrombolysis in the case of a bleed, or the tissue is not salvageable in the case of a patient who had a stroke of more than 4.5 hours, press the Ineligible button. If the stroke is eligible for TPA, press the Proceed button. If the patient is a candidate for TPA, we now have to tick off the contraindications checklist, which is marked in red. This is the absolute contraindications. Once it's checked off, proceed to the next page. The next slide is the dose calculator. Dosage for the TPA is automatically calculated. Give a bolus dose of TPA as a stat dose. You can press the bolus given button once it's completed and start the infusion timer for the remainder according to the amount that is calculated on the app. Once the infusion has been done, press the Done button. Congratulations, you have completed a TPA in a stroke patient. Complete the comment section if there are any additional issues that you feel that need to be addressed.